What is the most expensive patient in a hospital, and can we reduce these costs, or are they unavoidable? Most people assume that it's probably the patient that's going through major surgery or complex procedures, but in reality it's often the patient whose recovery has been prolonged, as a stalled recovery can quickly turn into one of the most resource intensive cases in a hospital. Every additional day spent in a hospital consumes staff time, bed capacity and resources. So as you can see, extended stays can significantly increase the cost of the care. Deconditioning can start within days of immobility. Loss of strength and independence can slow down discharge readiness. So, what's CareNet done to help this situation? So as a company, we figured out that getting a patient upright and out of bed earlier can support their physical and mental recovery. Hospitals that are already embracing this early mobilisation programme, they've come to us saying that they're saving around 1 to 2 days per patient. This is what it looks like for you in the real world. So, let me close the blinds for you to make it easier for the editors. So, let's say 100 patients are currently on this journey. That'll be 200 days saved overall, which, depending on the hospital and the level of care needed for the patients, it could be anywhere between 360,000 to 500,000 UK pounds saved overall. So what else is fantastic about the CH5 chair? Well, as you would all know, it's a chair that lies flat, which means that patients can be slid onto the chair whilst still too unwell to be hoisted. And they can start their recovery earlier. They can take part in therapy sessions and begin their early mobilisation journey. Well, not only is it a lay flat early mobilisation chair that can be used for this bed-bound patients that may even be on a ventilator, as you can see here, and taken outside back into a chair position, but it can be used right through a patient's journey. So we've designed the CH5 chair to work very well with standing aids. So what this means is there's no reason for a patient to sit on anything other than a lay flat CH5 chair right to the point of discharge, thus saving the hospital's money, and a lot of it. So going right back to the question asked at the start is, what is the most expensive patient in a hospital, and can these costs be reduced, or are they unavoidable? I think it's plain now to see that the most expensive patients are the patients whose recovery is prolonged and taking much longer than it should. So yes, this can be avoided by simply getting a early mobilisation programme within your hospital. And if you haven't got one already, then definitely contact us, because we can help you out. You can trial a CH5 on the unit. If you want to do that, our details are below. And thank you very much for watching. Don't forget to like, comment and subscribe to our YouTube channel, as this helps us get more of these content that you like out to you.